All right, let's dive right in. We're talking about a cancer drug today that has, and this is no exaggeration, completely changed the game. It's called Pembrolizumab, but you've probably heard of it by its brand name Keytruda. Now, this isn't your typical cancer therapy. It doesn't actually attack cancer directly. No, it does something way, way smarter. It unleashes your own body to fight the battle for you. And if you remember one thing from this whole explainer, let it be this. Just forget everything you think you know about chemo for a second. The entire job of this drug is to find the emergency brake that cancer has secretly pulled on your immune system and just release it. That one single idea, well, it explains everything.
So, this new weapon, how does it actually work? Well, it's part of a revolutionary class of medicines called immune checkpoint inhibitors. And trust me, it's a world away from what we usually think of when we hear cancer treatment.
To really get it, you've got to see the contrast. On one side, you have chemotherapy. Think of it like a carpet bomb. It just attacks all fast-growing cells, cancer or not. That's why people lose their hair. But then you have Pembrolizumab. It's more like a secret agent that reactivates your body's own special forces, your T cells, and basically tells them, hey, that all-clear signal was a fake. Go get the real bad guys.
Now, to understand why the solution is so brilliant, we first have to appreciate the problem. And the problem is that cancer is incredibly clever. It has figured out how to wear a kind of biological invisibility cloak to hide in plain sight from the very cells that are designed to hunt it down and destroy it.
Let's walk through this, because it's kind of brilliant in a really sinister way. So a T cell, which is your immune system's soldier, it rolls up on a cancer cell. But the cancer cell is waiting for it. It holds up this little molecule called PD-1, which is basically a fake ID card, a fake all-access pass. Your T cell has a receptor on it called PD-1, and that receptor acts like a safety brake. When that brake clicks into place with the cancer's fake ID, the T cell gets a signal that says, nope, all good here, move along. And just like that, the soldier is told to stand down, and the cancer is left alone to keep on growing.
Okay, so this is where Pembrolizumab enters the picture. It was designed for one very specific mission, to rip off that invisibility cloak and expose the cancer for exactly what it is.
And here's the beautiful countermove. Pembrolizumab floods your system, and it essentially just puts a little cover right over the T cell's PD-1 brake receptor. It physically blocks it. So now, when that same T cell approaches the cancer cell and the cancer tries to flash its fake ID, there's nowhere for it to connect. The stand-down signal is never sent, the brake is never pushed, and the T cell does exactly what it was born to do. It sees the cancer as a foreign threat, and it destroys it. Simple as that.
So, okay, that's the elegant science of it all. But what does this actually mean for patients in the real world? Well, the impact has been nothing short of revolutionary. And that's because this little braking mechanism, this PD-1 trick, it isn't used by just one type of cancer. And just look at this list. The number of cancers it treats is just staggering. We're not talking about one or two obscure types. We're talking about some of the absolute toughest cancers to fight. Melanoma, non-small cell lung cancer, triple-negative breast cancer, kidney cancer. The list goes on and on. This isn't some niche drug. It's a broad-spectrum weapon, all because so many different tumors independently learned how to use the exact same dirty trick to hide from our immune system. And all of that led to a truly historic moment in medicine. Pembrolizumab got the first ever tissue-agnostic approval from the FDA. And that was a massive shift in how we even think about treating cancer.
So what does tissue-agnostic even mean? Well, here's the crucial point. For this particular approval, it didn't matter anymore if your cancer was in your colon or your stomach or your pancreas. The location didn't matter. What mattered was the tumor's genetic fingerprint. If it had a specific marker, in this case something called MSI-high, the drug was approved for it. We officially started treating the cause of the cancer, not just where in the body it happened to show up.
But there's always a catch, right? Unleashing the full power of your immune system is a pretty serious thing. And when you take the brakes off a system that powerful, well, sometimes it can get a little overactive, and that creates its own unique set of challenges.
Yeah, these are not your typical chemotherapy side effects. They're in a whole different league with their own name, Immune-Related Adverse Events, or IREEs. And it's pretty much what it sounds like. This is friendly fire, your newly supercharged immune system getting a little too enthusiastic and mistakenly attacking healthy parts of your own body.
Let's just hammer this point home because it's really important. With chemo, the side effects happen because the drug itself is killing healthy cells. With immunotherapy, the side effects happen because your own immune system has become too aggressive and is causing inflammation in healthy organs. Totally different cause,
totally different kinds of side effects.
And those side effects can pop up almost anywhere. A revved-up immune system might decide to attack the skin, causing a rash. It could inflame the colon, which leads to something called colitis. It can even mess with your hormone-producing glands, like your thyroid. These side effects can be pretty serious, and a huge part of the treatment is learning how to manage them, usually with steroids, to kind of calm the immune system back down.
So, where does this all leave us? We've got this incredibly powerful, revolutionary tool that works in a completely new way, but it's one that has to be managed really carefully. Let's look at how this fits into the big picture of where cancer treatment is heading.
You know, it is not an exaggeration at all to call this a paradigm shift. The whole idea of using a patient's own immune system as the main weapon, it has opened up an entirely new pillar of cancer care. It sits right alongside surgery, radiation, and chemotherapy as a core strategy. And this might be the most hopeful part of the whole story. For the patients where this treatment really works, the effects aren't just temporary. The immune system can actually form a memory of the cancer. And what that means is, even after you stop taking the drug, your body's own defenses can keep the cancer in check for years, sometimes even longer. It's leading to the kind of long-term survival we used to only dream about for some of these diseases. And that really brings us to the final thought. Cancer was the first massive frontier for this kind of approach, but it's definitely not going to be the last. It really makes you wonder, right? If we can teach the immune system to fight cancer this well, what else is it capable of? What other diseases, from autoimmune disorders to chronic infections, are just waiting for us to figure out how to release the brakes?